Okay, I think we're live. Yeah.
Great. That's good.
All
So,
right. I'm just gonna check to see. I'm gonna go through using my phone to see if we have anybody live.
yeah, I don't know if people will be asking questions along the way.
Yeah, I think we should be able to see that.
We might just need to remind them at the start.
Hmm. Okay. Um.
Brightness, charging. Okay. So, actually,
Okay. So yeah. Um. We're live, and I can see that three people are watching. So we're just gonna go ahead and start the program. Good afternoon, everyone. Thank you all for joining in. And today promises to be very informative. As you all know, my name is Biodun, and I've got Linda here with me. And we're going to be talking about uh, roles and essentially everything trainee ACP, advanced clinical practitioner, and basically asking or debunking a lot of myths about the role and how people can gain entrance into it. Without further ado, I'm just going to start by reading Linda profile. And before we do that, I want to say a big thank you to Linda for um, making herself available for this session in order to educate us on essentially what trainee ACP is all about. I myself am also a trainee ACP, and I'm sure I'm going to learn some information from Linda, and I'm also going to be sharing my experience as well. Okay, so I'll start by reading Linda's short biography. Linda is a wife, a mom, and a content creator with a strong passion for nursing career mentorship, personal finance, and a Christian faith. She has supported many nurses through career guidance, interview preparation, CV and personal statement review, and general mentorship for those looking to progress within their profession. She's trained in the Republic of Ireland, completing a 4-year degree course in nursing and graduating with first class. Wow. She became a registered nurse in 2015 and began her career in respiratory nursing the same year. In 2017, she moved into intensive care where she continued to develop her clinical experience. Linda completed her postgraduate certificate in 2021, shortly after returning from maternity leave. She started her trainee ACP role in June 2022, and
yeah.
began her master's in advanced practice in September 2022 as well. She became a registered non-medical prescriber in October 2014 and completed her master's in advanced practice in August this year. She's currently working as a trainee ACP in acute medicine and an hospital in Midlands, where she continues to build her expertise and support other nurses on their journey into advanced practice. A big round of applause for Linda.
Hi, Biodun. Thanks for having me on.
Thank you for coming around. Thank you for accepting our invitation. All right, so I wouldn't waste much time. I'll just go right into the question because I'm sure that's what our audience are here for. First is, let's start with your clinical background. Can you tell us a bit more about that, about your nursing background, basically?
Yeah, so I think you've covered some of it in your introduction, to be honest. So I trained in the Republic of Ireland, and over there, the nursing degree is a 4 years Bachelor of Science degree. And so straight after qualifying, I worked in Ireland briefly for a couple of months before moving to the UK. And then moving to the UK was a completely different ball game. Like anyone that's had to relocate as a nurse would know that there's a lot of challenges you face, obviously, when you start as a nurse. But yeah, so I relocated to the UK in 2015 and started initially on the respiratory ward, general wards, respiratory ward. And that season was all about just gaining competence to work as a nurse. Then after some time, I moved to intensive care units where I worked for about 5 years in intensive care units. And then obviously had to go through the whole process of gaining competence as an ITU nurse. And then, of course, COVID came into place and made things quite difficult. But looking back now, actually, it was a blessing in disguise because it was a time for a lot of ITU nurses to gain competence, to demonstrate leadership skills, all those kind of things. So after some time in ITU nursing, I then went on to do my postgraduate certificate in critical care. And then that then formed kind of the cornerstone for me to apply for the trainee ACP role. So in June 2022, I started my role as a trainee ACP and then had to go through the whole process of completing the full masters. But yeah, it's been quite an interesting journey so far.
Yes, it's been an interesting journey. I agree with you. You know, from the point where you graduated to being a respiratory nurse, which I believe help you to advance in ICU, and then doing your postgraduate, and then now you're a trainee ACP. I can see the smooth transition there. We'll move on to the next question, which is who are advanced clinical practitioner and how do they fit into the wider workforce of NHS plans? Because I know a lot of people do not know what this role is about.
Yeah.
There's not much awareness about the role. So I want you to begin by telling us who an ACP is and how do they fit into the plan of the NHS.
Yeah, so ACPs are essentially advanced clinical practitioners who they are healthcare professionals who have gained advanced knowledge and skills to be able to work as part of the medical team. So there's a lot of terms that are used interchangeably for ACPs. Some refer to them as AMPs, some refer to them as APs. AMPs will be your advanced nurse practitioners, while APs will just be advanced practitioners. But essentially, they are advanced healthcare professionals that are able to work competently as part of the medical team. So they usually come from a registered healthcare background. So a lot of them are nurses, but you also have people that are paramedics, pharmacists, physiotherapists, SALT team as well, occupational health therapists. They are registered healthcare professionals. And then on top of that registration, they also have to gain advanced skills and advanced knowledge. So they have to work within the 4 pillars of advanced practice, which is clinical practice, leadership and management, education, and research. And then they have to go through the full training to be able to work at an advanced level. It's a lot of responsibilities, and I know that the pay also reflects the job that they do. But essentially, as an ACP, you should be able to see a patient right from the start, from when they. So imagine a patient comes into ED, for instance, with chest pain. As an ACP, you have to go through the whole process of taking that patient's history, performing your clinical assessment for that patient, deciding on which investigations you want to order for that patient based on your clinical assessment, and then order those investigations, interpret the results, and then based on the results, come up with a management plan for that patient. So there's a lot involved, and you have to kind of work on your competence to be able to achieve all these advanced skills. It takes time to be able to build these skills, but essentially, you're working as part of the medical team alongside the junior doctors as well. And you should be able to manage your own caseload of patients and be able to manage your patient from the moment they walk into the hospital to when you decide that they are medically fit for discharge. So that involves you having to gain a lot of expert skills. So skills like interpreting chest X-ray, ECGs, and clinical assessment skills, prescribing for your patients, even diagnostics for your patients. So you need to be able to go through all those steps as an ACP. So that's why they work at an advanced level. And because of this, the salary for ACPs reflects that responsibility. So they're not there to replace junior doctors, because I know that's one of the common myths that people get. They're not there to replace junior doctors. They don't have any medical qualification, but they are trained to a high level and a high standard, because the whole idea within the NHS is that when you see a junior doctor and when you see an ACP, you should be able to get the same level of care to an advanced level. So all the knowledge and experience that you would expect that junior doctor to have to look after that patient is what an ACP has to go through to be able to competently assess and diagnose that patient. So as an ACP, you initially start off as a trainee at either a band 6 or a band 7 level, depending on the employer and depending on the role that's been advertised, and also depending on your experience as well. You start off as a trainee at a band 6 or a band 7 level. But by the time you qualify, you then start working as a qualified ACP at a band 8A. I don't think there's many jobs within nursing that gives you that fast career progression without having to go through multiple interviews.
It's most likely in leadership, nursing leadership, that will take you to that level of band
Exactly.
8A within 3 years. That does not say it's not possible, but yeah, it's very streamlined, and I agree
Yeah.
completely with your explanation.
But the unique thing about the role is that you could start off a band 5 can get a trainee ACP role as a band 6. And without having to do any extra interviews or extra job application, you can go from that band 6, go through your training, qualify, and go up to band 8A without having to do any extra job application.
I see where you're coming from, but I'm really surprised that there are some band 6 trainee ACP role. I wouldn't have, agreed to that. Like, trainee ACP role should actually be minimum band 7. But
Yeah.
again, if you say it's out there, I wouldn't debate that. But
Yes.
that's not something that I would really, really want to jump on. For career advancement, yes, but band 6 trainee ACP, the responsibility is higher for band. It's more than band 6 level.
Yeah, it is really. So I started off as a band 6 trainee ACP.
When did you now transition to band 7?
So in my trust, what they do is that they take you in as a band 6. And honestly, I think they do that to save money more than anything else.
Okay.
But then the whole argument is that if you're coming in and you already have some of the modules, like your physical assessment module, or you're a prescriber, then potentially you can start off as a band 7. So what they do is that regardless of whether you are already a band 6 or not, when you come into my trust, they take you on as a band 6, with the caveat that within the first year, you complete your physical assessment module, you then start off your prescribing course, you start seeing patients independently, and then they upgrade you to a band 7. So that means that technically
I
in my
see
trust,
where that transition is.
yeah, so people start off as a band 5 in my trust, and a band 5 that applies to be an ACP, a trainee ACP. So they get that job as a trainee ACP band 6.
Band
Within a
6.
year, they then become a band 7. And then by the time they fully
They are
qualified,
done with their masters, they become band 8.
yeah.
Okay, I see that transition, but mine was different. I started as band 5 nurse in the ED, and then transitioned to be a band 6 nurse in another department, and then I got the role as band 7 trainee ACP. And again, that's debatable, but I see where the transition is for you in that regard. Thank you for your response to the question. The next question is, you mentioned in some of your videos on your YouTube channel. By the way, Linda has a robust YouTube channel where she talked about ACP. And for those interested, please, I'm going to drop a link to our YouTube page in the description. Please do check her out and take advantage of those videos because they're very informative. You did mention that you ACPs work across many specialty, and some ACPs, training ACPs, are in ED, acute medicine. I'm in ED, you're in acute medicine, I know some trainee ACP are in the community and
Yeah.
the rest. How does the role varies? If some are in ED, some are in trainee ACP, where does that split comes in from?
Okay, first of all, I have a lot of respect for ACPs that work in fact, nurses, anyone that works in ED, I have a lot of respect for them because it's such a fast-paced environment. And I don't
I
know if
agree.
I'll be able to handle such a
Yeah,
fast-paced.
we are adrenaline junkie. That's not the problem. It's because we like the adrenaline that comes with working in an emergency area in a fast-paced area. That's for me. I would say for me, that's why
Yeah,
I enjoy the most. We're in
yeah.
a busy environment. It's chaotic, but you're calm because
Wow,
it's.
wow. It's
I
a
don't know how to put it into words, but I can't. I don't know. I can't. I don't. I want a place where there's like practical things to do. Unlike some
mhm.
departments where it's a bit calm, and it sometimes just get boring.
Yeah. So so depending on the specialty, the clinical skills that you'll be expected to gain as a ACP or trainee ACP would be different. But the whole idea is that you're able to work at an advanced level. So regardless of where you work, whether in the community, in hospital settings, in ITU, you need to be working at an advanced level. That's standard for all ACPs. Aside from that, the clinical skills that you'll be expected to have will vary depending on where you work. So,
Yeah.
for instance, an ACP working in intensive care unit, for instance, might be expected to be able to insert
Intubate.
central lines or
Yeah.
insert arterial lines, those kind of clinical skills. Whereas an ACP in acute medicine would not need those skills because they don't see those kind of patients. So, what determines the kind of skills that you need for your for you as a trainee ACP or an ACP is basically the area where you work, your past experience as a nurse, the service needs as well, the kind of patients that you see. So, for instance, a qualified ACP in ED might be expected to have knowledge of cardioversion, but an ACP in, I don't know, ITU or in the community, say in the community, for instance, would not be expected to have that clinical skill because it's not essential for their role. It's beneficial if they have it. It gives them a better advantage if they have it, but it's not essential for their role. So basically, but regardless of where they are based, they need to be able to function at an advanced level, and certain things will be kind of expected. Like if you're a nurse working as a qualified ACP, then being a prescriber, excuse me, then being a prescriber is kind of expected, regardless of
Yeah.
where you work, because you will need that skill. But then, so the way they think about this is that you have your core skills, which all ACPs will have, like venipuncture, ECG, interpretation, those kind of things. And then you have your role specific skills. So I think that's what really differentiates them. It depends on where you work, it depends on the clinical skills that are necessary for your area of work. But regardless of where you work, whether you're a nurse, paramedic, regardless of your background, you need to be able to function at an advanced level. It's a lot of responsibility.
Absolutely. I do not doubt that one bit. And in order just to add a little bit, I think the most important thing for all training ACP training is you're trained under that pillar. You have that clinical exposure, you have the education, research, and leadership. So all ACP go through this four pillar of training,
Yeah.
irrespective of your specialty. And then your specialty will now have some add-ons trainings to you. So that's where, depending on your area, like you said, in the community, the training will be different. In ED, for my example, we're trained on how to do some certain procedures like suturing,
Wow.
ECG interpretations,
Mm-hmm.
plaster, and
Mm-hmm.
trauma calls and all that, cardiac
Wow.
arrest, advanced trauma, advanced trauma life support trainings and the rest. So I
Wow.
think, like you rightly said, your specialty you determine the kind of subspecialty training you're going to receive. But standard across board, all ACP receive trainings in those four pillars that was mentioned earlier, which is clinical, leadership, education, and research. All right, let's move to a juicy question. How can you just walk us through the process of securing a trainee ACP job and what are the basic requirements? So if anybody that's listening to us is interested in becoming a trainee ACP, how can they secure it? want, how can they secure this role? What is the requirement?
So this is probably one of the most commonly asked ACP question on the internet.
Yeah.
And there's a lot of misconception about what you actually need. So the official requirement, the official basic requirements for most trainee ACP posts is that you have, number one, your qualification. So if you're a nurse, you have your Bachelor of Science degree in nursing, and then you have at least 3 years post-registration qualification. Sorry, post-registration experience. So of course you need to be registered with the NMC, have your bachelor's degree in nursing, have 3 years experience as a nurse. Those are the three main key ones. And then on top of that, you need to have evidence of clinical leadership. So that evidence of clinical leadership does not necessarily have to be a band 6. You don't have to be a band 6 on a ward or where you work to be able to apply. But you have to be able to demonstrate both at your application process, when you're putting in your application, and during your interview as well. You need to be able to demonstrate evidence of leadership. And that's the one key thing, because I recently, when I was recruiting for my trust, I was part of the interview panel, looking at application and actually interviewing candidates for the trainee ACP role. So one of the key things that they look out for is that evidence of clinical leadership. So if you're not a band 6 already, you need to be able to demonstrate that. And it can be things as simple as I've acted as a nurse in charge in the absence of the ward manager. I've been able to step up in the absence of a ward manager or, a nurse in charge. You need to be able to demonstrate that both in your application and in your interview as well. Now, aside from these things, there are other things that will kind of give you an advantage. So, for every application, when you look at the Trainee ACP application, it will tell you essential criteria, which are the ones that we just talked about. Then it will also go through desirable criteria. Now, those desirable criteria are the ones that will give you an advantage, because let's be honest, the role is very competitive. Biodun, as well, when you do the application.
Yeah. Very competitive.
Very, very competitive. You could have up to, the last time we did that, in fact, we had a vacancy for a trainee ACP post. We had 59 applications for one job. 59. 59
Wow.
applications for one job. So because of that, they had to close the job advert early, because that's just way too many people fighting for one job. So I said that to say that when you look at the job application, focus on getting those basic criteria first. And then after that, look at the desirable criteria. The basic ones are the ones that you have to even get through to interview, you have to have. And let's be honest, 3 years post registration experience, you really need that background if you want to go into ACP. I've had people that are just newly qualified looking to start the program. And I'm like, no, let's not rush this process. Let's try and get that basic nursing knowledge first and then apply. So once you have that basic criteria, you can then add some extra things that will give you an advantage. Now that depends on the job that you're going for. So for instance,
specialty.
Exactly. So it depends on the specialty that you're going for. So for instance, if you have 3 years experience as a nurse working in, in a nursing home, for instance, and you want to become an ACP in a hospital or in ED, for instance, it will give you an advantage if you actually gain some experience in ED. So that will follow that your desirable criteria. So in that case, you have to maybe go for rotation to ED or look for a job in ED just to gain that extra knowledge. So that's one thing that will give you an advantage. Another thing that kind of gives people an advantage, this is debatable now, and it depends on where you work and on the job advert as well, is postgraduate study. So some employers will tell you that they want evidence of being able to study at master's level. So for me, for instance, I had a postgraduate certificate in critical care. Now, this is not essential. You can still apply for the trainee ACP job, even if you don't have that.
Yeah,
or
but this is
something
like, this
that at
is
least
just like,
going to give you an
a
advantage.
desirable, yeah, advantage. So it
Mm-hmm,
just
mm-hmm.
adds up to your application. It makes you different. I can imagine if you're part of the 59 that apply for a trainee ACP role, even though you're fulfilling the essential criteria, you need something to demonstrate that you are exceptional, because they're only
Absolutely.
going to pick someone. And if you want to be that person that they're going to pick, you need to demonstrate that. So you have to
Yeah.
have, added learning experience,
Yeah.
and that leadership skills. I
Yeah.
completely agree with what you're saying.
Yeah. So that's the thing. So once you look at these criteria and you feel like, right, I have the basic criteria, then you need to go online and find a trainee ACP vacancy and apply for it. And then you just kind of take on the process from there. You go through the process of interview, and then you finally get into the training position. Now that is where the journey starts because that's where the journey starts because when you then successfully pass interview and they're like, welcome to the team, congratulations, it's a whole different journey. It's a whole different journey.
Absolutely.
But like when
Absolutely.
I applied, there was over 100 applicants for 10 jobs. 10 or 12 jobs. There were over 100 applicants. So they had to go through two interview processes, which is a whole different story. And I don't really want to go into much detail because of our time. But essentially, because there was over 100 applicants for just 10 jobs, they had to break the interview process into two stages to screen candidates. So that's why I say also look for those things that will give you an advantage, because out of those 100 people, if you have all the basic criteria as well as having some evidence of postgraduate study, it gives you an advantage over the remaining 99 candidates.
I mean, there are so many things that we can talk about when it comes to securing a trainee ACP role, but I think you've established the most important thing, which is have the essential criteria, 3 years postgraduate nursing experience. Um, I would have said be a band 6 nurse, but again, there are some trainee ACP roles that start from band 6 level. But I don't think it's wrong if we say that being a band 6 nurse will give you an edge.
Yeah, absolutely.
Because
So the way I
because
look
you
at it and the way I then describe it to people when I do my coaching sessions is think about the four pillars of advanced practice. You need to demonstrate that you have evidence of those of working within those pillars. So, like you rightly said, Biodun, you could be a band six nurse who's maybe, I don't know, a band six nurse on the ward, or you could have like a research background, or you could come from a teaching background. Let's say you're a practice educator, or you've worked as a band six, teaching and mentoring other people. So you need to think about they need to think about the four pillars and then think about how you demonstrate that at interview, because that's going to be one of the questions they will ask you at interview, and also one of the things they're looking in your CV to see that you're able to demonstrate that.
Mhm. Absolutely. And on top of that, then you now need to have, a little bit hedge depending on what you're applying for. And that is not to say that, okay, if you work in ED, you cannot apply for a trainee ACP role in Trainee or in Acute Medicine or in ICU. But again, you want to put your best foot forward, have the
Mm,
right knowledge, have the right exposure, training, you know,
absolutely.
because for me, I applied first in Freighty and I was declined because I don't have much Freighty experience. But when I applied in ED, they picked me
Who
on
declined an
first.
ED nurse? Who declined an ED nurse?
Actually, they thought, in the interview, I'll be honest with you, they said that based on my experience, I'll fit into a role as a trainee ACP in the emergency department. And I agree with them because, that's been my exposure. All my nursing clinical experience has been in ED. So this is
Mm,
just goes to say that you want to put your best foot forward by gaining enough experience in the specialty that you're interested in. But that is not to say you cannot apply for trainee ACP in other roles. But
mm,
again, just be aware that it's competitive, but you can actually get the role. I am in the role. Linda is in the role. That's enough evidence to show that yeah, you can be selected for this job, but you just need to put your best foot forward by gaining the essential skills and also demonstrating some further, trainings and expertise so that they'll pick you. All right, moving on to the next question. And I think this just linger on based on what we've shared earlier. What should nurses start doing early if they want to become a trainee ACP?
So, what should nurses start doing? I think that depends on where you work. So, I always say nursing as a career is a journey, right? And you have to be willing to go through that journey. I always say to people, think of what your dream job would look like, and then start mapping out the process of how to get to that dream job. So if you are someone who's aspiring to become an ACP, there are steps to it. You're not going to go from a student nurse, for instance, or a newly qualified nurse to training ACP post the next day. And that's okay. But you have to be willing to go through that process. So for different people, the process will look quite different depending on where you work. But the first step would be, first of all, gain competence as a band 5 nurse. Gain that competence, be good at your job, know your patients, know how to look after the most complex patients in where you work, know how to be able to advocate for your patients. Once you've gained that and you master that basics of nursing, then you need to move on to the next level. And that would be things like looking for opportunities to gain more responsibilities. That could be things like taking on student nurses, mentoring student nurses, acting as link roles within your area, looking for any little opportunity that will give you that extra advantage. Because when it comes to time to apply for the trainee ACP role, these are all the things that you put down on your CV that will give you an advantage. So look out for all these little opportunities. And another thing as well is please be dedicated to self-development. And I think that's something that's so key, whether you are looking to become a trainee ACP or you have a completely different dream job within nursing. If you are someone that wants to progress in nursing, you have to be dedicated to self-development. There's just no way around it, because that gives you the knowledge, the skills, the experience that you need to be able to step up to the next level. So once you've done that, and that self-dedication, self-development looks quite different for depending on where you work. It can be things like taking on leadership courses. It can be things like going for inside visits to different areas just to gain a better idea, a better understanding of what they do in those areas. It can be things like postgraduate modules. Some postgraduate modules are literally only 3 months, and they are trusts that will actually sponsor you to go back and study at university just for 3 months. So it can be little things like that. It can be online courses that you can do through your trust learning portal. There are so many things that you can do, but be dedicated to improving and try not to be in the same spot, because that's one of my greatest fears, standing in the same spot for too long and not growing or not doing anything different. So another thing you could also do is start looking for ways to gain extra skills so that you're constantly improving yourself. So if you know that you want to become an ACP, just go online, check out an advert for a trainee ACP post. Look at the essential criteria and start looking for little ways that you can tick off all the basics that they want. So that when the job advert comes up, you are ready for the job. You're ready to go. You're ready to put in the application, because you've taken time to work on yourself. You've taken time to improve yourself and to gain all those basic criteria that they want. And I always say to people as well, if you know that you want to become a trainee ACP, or in fact, not just a trainee ACP, any role within nursing, any leadership role within nursing that you want to achieve, look up those job adverts and then see yourself as a trainee ACP in training, if that makes sense. So you're going to become an ACP in future, and then start thinking about little ways that you can start gaining those skills. It can be something as simple as learning to take bloods on the ward. If no one else around you is doing that, and you are one of the 3 people out of 20 nurses on the ward that can take bloods, that's already giving you an advantage.
That's giving you an edge
And these are things that
above
you can
other
also put
people.
down on your CV when it's time to apply for that job. So look for little ways to gain all these extra skills. Another thing I think is so important as well, I don't know if you agree with this, Biodun, I think sometimes it depends on where you work and the kind of ACP role that you want, is be willing to step out of your comfort zone and move to other areas if you have to gain that
Yeah,
exposure that you want. And I say
Absolutely.
this because sometimes you might see a nurse working in somewhere like, I don't know, eye
Oh, yeah.
outpatient clinic for ophthalmology, something like that, where what the main thing they focus on is eyes. And you
Yeah.
want to work as an ACP in ED. Do you get what I mean? You're going to have to move from that eye out. That you have to move from there.
Yeah.
Move from there
Yeah.
and maybe go somewhere else, maybe ED or medical assessment unit. That will give you exposure to different cases, different types of patients. Because these
Yeah.
are all things that build your confidence, build your skills, gives you an advantage when you put it down on your CV. And
Yeah.
it just demonstrates that you're able to function within those four pillars of advanced practice.
Yes. Thank you very much. I mean, you've hit the nail on the head. For me, what I'm just going to add to what you've shared is documenting your evidence. And it's something that a lot of people don't do, which is very important. It was the day that I was applying that I realized that I've been able to gather the evidence that I have certain trainings, and it really
Mm.
helps my application. Because it's not after 3 years or 4 years that you now start thinking
Mm.
of the training you did
Yes, absolutely.
for
Yeah.
there's no way you're going to track those records if you don't
Yeah.
document it. So if you're listening to us and you're interested in the XCP role, but you're not ready now, or you feel like you don't meet the criteria now, this is the right time to start penning down your courses and trainings that you've had. Those
Mm.
yeah, catheter training you've done, venipuncture that you've signed off to, venipuncture training
Yeah.
sign offs, your BLS, your ACLS. You need to document them, the days that you've done the training, are they up to date? So that when you're applying, it's very easy for you to apply. And talking about
Hmm.
putting your best foot
Absolutely.
forward, I remember in my training, not training, in my interview, I documented that I've passed 10 class, and one of the consultants took note of that. And the person said, like, does that mean you can practice in the US? I said, yes, I have a license to be able to practice in Texas. And they were like,
Yeah.
wow, that's interesting. And I could I had a joy at that moment because I'm sure that there's no, maybe I'm just saying, maybe other candidates have NCLEX or they don't have NCLEX, but I just know that
Yeah.
being 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 having NCLEX actually just it made a difference at that point.
Mm.
And I'm not saying that, oh, please, for those listening to us, for you to apply for GA, you have to have NCLEX. No, but I'm just saying
Yeah.
again, if you think that you want to put your best foot forward, you need to start
Yeah.
thinking of what are the additional things you can do.
Yeah.
NCLEX is
Yeah.
not a criteria, but it's like
No, sir.
putting your best foot forward. I don't know if you
Absolutely.
agree to what
So
I'm saying.
that's it's absolutely right because it goes back to what we are saying earlier on. Imagine that there's 100 applicants for, I don't know, 10 jobs. And I always say to people that I mentor, think about ways that you can stand out in the application. What do you have that the next candidate don't have? Now, like you said, NCLEX might not be it's not an essential criteria because it doesn't really apply to UK. But there's a very high chance that the next candidate will not have NCLEX. Because what usually happens a lot of times, especially with internationally trained nurses, is that they tend to disregard the experience and the knowledge that they've gained before they enter the UK. You see?
Yeah,
But those are the
yeah.
things that make you stand out. That's what makes you different
You
because you've been
mentioned
able
that.
to,
Yeah, I remember when I was
yeah,
doing
because
my
you can
interview, you
work
did
as a nurse in
mention
the
it.
US, you've worked as a nurse in Nigeria, you've worked as a nurse in, I don't know, in the Philippines. Because of all this extra experience that you've had, it actually is an advantage. I honestly think it's a strong advantage because to me, it shows that you're adaptable. I'm looking at it from a recruiter's point of view now. It shows that you're adaptable. It shows that if they put you in any clinical environment, you can gain experience quite easily because you're able to adapt to new environments. It also shows that culturally, you're able to work with people from different cultures. These are all the things that make you stand out. So, although you might say, "Oh wow, well, NCLEX is not a requirement," it's not just about NCLEX. It's about this person is so diverse that yes, the
Yes,
US they're able to
that
work in
was the
US.
impression I got that day. That this
Absolutely.
person is able to think outside the box,
Yeah.
and this person, this person is thinking far and wide. This person have done like it was just like I was like, wow, I'm glad I did my NCLEX. You know,
Yeah.
wow, interesting. moving on to the next question. What would you say to a nurse who is interested in this training role, but they are not sure if they are ready? They are not sure if they can survive the education and the workload. It just looks so much to like, take it all in. What advice would you give such person?
So someone that so they want to apply for the ACP job, but they don't know if they are ready, right? So
Yeah,
it
they don't
goes
know
back
if
to what we're
this role is for them. They don't know if this is something they can do.
okay. So if I was in that person's shoe, because honestly, this is probably where I was a couple of years ago. The first thing I would do is understand the role, understand what you're applying for, because I think it's very easy to glamorize being an ACP. Oh wow, you're getting paid band 8A, you're earning over 55 grand a year, whatever. It's very easy to glamorize that. But you need to actually understand what is involved. Understand the responsibility of an ACP. So number one, I would do research online, Google videos on YouTube, Google, join live sessions like this, understand what the role is about. Do your research first. Second thing I would do as part of that research, actually, I would look for an ACP within my trust or any ACP that you know and go for an inside visit, because that gives you an idea into the job. It gives you an idea of what they do on a day-to-day basis. It gives you an idea of what's expected of the role. It gives you an idea of the pressure and the responsibility involved. The third thing I would do is find mentors. Oh my God. Like I talk about this a lot because not just for a nursing career, in anything you do in life, you need to find mentors. For me personally, I have mentors within ACP. I have mentors in personal finance, mentors in my spiritual life. Every area of your life, you need mentors because the amount of information that they can give you, it can put you 10 steps ahead of your competitors. Imagine you have a
Yes.
mentor who tells you that, oh, actually, I interviewed candidates last week for a Trainee ACP people. These are all the questions that they asked them. It already gives you an insight and puts you ahead of competitors who have, never spoken to a mentor before. One of the mentors that I had, for instance, was a lady that was a paramedic and had two kids while doing her ACP training. Because when I applied, I was on maternity leave thinking, how am I going to combine ACP training with a 9-month-old baby? How am
Baby.
I going to do that? As well as pressure from everything that
Even
was
those that
coming.
are single, we are still struggling.
You see, just see
Not
what
to
I
talk
mean.
of those with kids.
And it's
Yeah.
enough to put you off. But sometimes you just need someone that's a few steps ahead of you to say, look, this is the path I follow. This is how I did it. You're talking about having a 9-month-old baby. I had two children while training. I had to take gaps out of training. And the day she was speaking to me about this, I had never met this woman before, but I had one conversation with the right mentor. One conversation with her, I was like, that is it. I'm going for this job. Regardless of what it takes, I'm going for this job. So you can't overestimate the importance of having mentors. Even throughout the training, even while you're training, you still need them. You still need them. So what I would say to that person is look at the job criteria, do your research, do inside visits, speak to mentors, start preparing yourself. Because the honest truth is sometimes I think people wait for the right opportunity. Oh, I'm waiting for the right time. I'm waiting for the right time. But then time keeps going and the
Time
years
is
keep
going.
running by. The rules
Yeah.
keep changing.
Mm.
The rules keep changing. You're giving up opportunities. And at the end of the day, I would say just go for it. Don't wait until you have 100% of everything it says on that job advert. Just go for it because you never know. If you don't try, you never know.
Absolutely. I agree with everything you said. I think more emphasis our place is on actually doing the shadow shift. If you want to be sure if this role is for you, find a trainee ACP and shadow them for a day. Follow them around, see what they do, ask questions, and have a glimpse of what it takes to be in that position before you then jump, because it can be quite challenging. And if you're not ready for it, I've seen a lot of people break down and they're in this role. So, yeah, I would emphasize on that. We're actually running out of time. I think we have 15 minutes more, but we'll try and cover all the questions before we end. Let's talk about self funding for trainee ACP role. if the trust is not funded, because one of the key thing about this role is that the trust has to support you financially and also
Mm.
support you clinically. But what is your take about those that are considering funding themselves for this training role?
I honestly think the self-funding should really be after you've explored all other options. I'm not against it. I think it has a place because considering how competitive the ACP role is, a lot of people would normally resort to self-funding. But the honest truth is that self-funding the full masters a lot of times is not the best idea. And that's because, like you said, Biodun, it's not just the financial cost of funding the masters, it's also the support that you need, the clinical support that you need. So, for instance, if I was a band six and I've applied for trainee ACP roles multiple times and I'm just not getting through, what I would do in that case is look for the modules that I can self fund myself. However, make sure that those modules align with what you're doing at the moment. So, for instance, if I was a band six on the ward and I want to become a trainee ACP and I'm not getting through, I would find maybe like a clinical specialist role that would possibly fund me to do a prescribing course. Because I know that once I have that prescribing course on my CV, I can then use that to apply for a trainee ACP role and it will give me advantage. That's absolutely fine.
Yeah, that's a very good
But for
strategy.
some people, they think, all right, let me just self-fund the full masters because they don't want to give me an ACP post. So let me fund the full masters. Then after the full masters, I can apply for the
The
ACP job.
full training ACP job, yeah.
The challenge with that is that paying for the self-funding is actually the easy part. And I know it's a lot of money, but if you have the money to self-fund, the actual payment is the easy part because for some of the modules that you do, like your clinical assessment module and your prescribing module, they need you to have a clinical supervisor. They need someone at work who will supervise your practice and watch you undertake those skills in prescribing or watch you undertake those skills in assessing patients and then sign you off to say this person is competent or I've assessed this person for, I don't know, 60 hours. For prescribing, for instance, a lot of times they'll tell you you need to undertake 90 hours of prescribing. So if you decide to self-fund, it then becomes a challenge when you need a clinical supervisor to be able to sign you off on those skills. And that's a lot of time, that's the challenge, is that universities for some modules, in fact, for some modules like prescribing, before you even start the module, they want to see your clinical supervisor's details. They want to see your practice supervisor's details. They want all those things outlined before they can actually let you start the module. So at the initial start, it might be a good idea if there are modules that you can do, that you can then put towards the ACP. And I know candidates that have done that and it's been very successful for them. One of the candidates I met was a CNS, respiratory CNS, that got funded for a prescribing course, then use that module to apply for the trainee ACP post. That's absolutely fine. But please think about other criteria that are very, very essential for these modules, like your clinical supervisor. And then aside from that, remember that to become a trainee ACP, you're going to be completing your portfolio at work as well as working. So there's a lot of pressure involved. Let's imagine best case scenario, you're able to do the full masters self-funded. What about your portfolio? So it's also important to think about it because the whole idea in the trainee ACP post is that you're able to gain clinical skills, get signed off as competent in those clinical skills while you're studying for your masters and working at a trust. So I would say you could look at self-funding as a last result, but make sure that you're picking modules that you will not struggle with a clinical supervisor. But then along the line, you need to also have a plan of how you will switch to the trainee ACP job. Because ultimately,
With
that's
your
what you want,
trust,
the trainee
yeah.
ACP job.
Yeah, we with potentially getting trust funding for it, because it makes the whole journey easy, and at least they take off that financial pressure from you
Yeah.
rather than you funding yourself, and also you get the support. Uh, how have you been able to manage working alongside studies? I know you're done with your training role, or let me say your master's now, but looking back, how have you been able to manage life as a mom, content creator, faith-based Christian, trainee ACP, masters,
Hmm.
and the
It's,
job itself, because you go to work as well? How have you been able to cook all of this together and still look like this?
it's honestly God.
God
God.
has
This is
been
why my
faithful.
faith is so important to me.
Oh yeah,
Because there's
absolutely.
a very, very important scripture in the Bible that says that it's not of him that runneth. Sorry, it's not of him that runneth, but basically it's by the grace of God. And I honestly believe that if God starts something with you, then he's going to see you all the way through. Because my daughter was only 9 months old when I started. And I remember the first week in induction week, when they were giving all the training, welcome to ACP, welcome. And I sat there thinking, only half listening, because a part of me felt like I won't be able to get through the program. Not because I wasn't smart enough, but the pressure of having a 9 month old baby, having a young family, being a wife, being a content creator, um, working in a new environment, there was a lot involved. But what I would say is you need to put in strategies to make the journey easier for yourself, and that depends on where you are, who you are. Some of those strategies can be things like, for instance, when it's coming to assessment deadlines for modules, I take annual leave, because I know that my focus at that point is the module. It's almost like juggling different balls, and you're trying not to drop any ball, any of them. So you have to put strategies in place, have productivity hacks that kind of help along the way. Some of those productivity hacks for myself is that I study best at night time. When everyone else is asleep, that's when I study best. Sometimes it can be things as using downtime at work. Downtime when colleagues start chatting about, or coffee break, or those kind of little times. I have a plan in advance, so that when I get 15 minutes at work, I have an article. Let's say I have an article on respiratory I need to read, or there's one thing or the other I need to read. Another thing as well is going back to mentors. Because say for instance you get feedback at work that says, oh, you need to improve your knowledge on resuscitation, for instance, or your knowledge on gastro, for instance. Your mentors already know the best people to contact in gastro. They already know the best resources available for you to improve that knowledge. So have a chat with them and really be honest with yourself to say, right, this is where I am. This is where I'm struggling with. This is what I need to improve on. How do I do this? How do I actually achieve this? And have conversations with these people, because they will guide you, they will tell you, they will show you the relevant resources. That's what I mean when I say that they will kind of put you 10 steps ahead, because they've been there, they know exactly what you need at that point. And another thing as well I think is quite helpful is, I don't know if you have it in your trust, Biodun, but having other training ACPs around you,
Yeah,
because if you're struggling with one thing, there's a very high chance that they're also struggling with the same thing. So sometimes it's a good idea to kind of bounce ideas off each other to be able to learn and grow and kind of be more efficient in improving that knowledge.
absolutely, absolutely. I agree with you. My go-to person first would be my colleague, my trainee ACP colleagues, and then the next people in line are those that are already practicing, like the ACP, the full-fledged ACP, and then consultants and the rest. Can you just chip in on imposter syndrome? How have you been able to manage imposter syndrome? I know by now you're I don't want to say you're a boss, but when you started,
Imposter
how are
syndrome
you
is
able
real. It's
to,
real.
how are you don't have imposter syndrome anymore now. You
No,
can even close your eyes and
the
practice.
crazy thing about this building is that even qualified ACPs get imposter syndromes. Even doctors get imposter syndromes. It's basically and I think a lot of times it's actually you in your head doubting yourself because
Yeah.
you're in an unfamiliar situation or in an unfamiliar environment and you're looking around like, is this actually me? So I think number one is self-awareness. Have an awareness of why you have imposter syndrome. A lot of times it's literally because you're doing something new that you haven't done before, and that's okay. um have an awareness of the things that you need to improve on, because sometimes it's fear of the unknown, fear of things that you don't know. You're seeing a patient for the first time with a new clinical presentation that you haven't seen before. Have an acknowledgement of that, because what happens is, if you're able to have that self-reflection and self-awareness, you can then go back to say, right, I doubted myself there because I haven't had much experience with, I don't know, chest pain. So because of that, I'm going to focus on chest pain and improve my knowledge. That's one way. Another thing I find as well, because this happened to me when I first joined the team, when all the other trainee ACPs have worked on that team for like 15 years, there's no how I'm going to make up for 15 years of experience. Because really, that's what happens. We compare ourselves to our colleagues and
To
think, oh,
others,
these
yeah.
trainee ACPs know, they know all these things. Why don't I know it? And I'm supposed to be a trainee working at the same level as them. Well, it's because your experience is different. And that also means that you also know things that they don't know. You get? So at one point, I said to myself, stop comparing yourself to people that are 50 years old. They've worked in that department for 15 years. You're coming in brand new and trying to compare or match up with them. It's not possible. There's only so much you can read from books, unfortunately. So I think it's just taking, and also give yourself grace. Give yourself grace, especially when you're just starting up within the first one or two, first year one, year two ACPs. Give yourself grace, because you're not going to learn everything all at once. It's going to take time for you to be able to develop that knowledge, develop that skill. It's going to take time, and growth is uncomfortable. So give yourself time to learn. If obviously you get to year three and you find that you're still making the same mistakes you made in year one, okay, then we can start to get worried. But while you're, and that's my mentor always tell me, you're a trainee for a reason. It means that you are training. So don't expect to know everything. One thing that really helps me as well is to focus on your strengths, because regardless of where you are coming from, you have strengths that other even qualified ACPs don't have. Do you get? For instance, for me, my strength was that I worked in ITU. So,
Yeah. So you're very
so
good with respiratory,
yeah, there were instances
organ
where even in
failures
year
and all.
one, even within the first month of training in year one, me and other trainees will walk into a cardiac arrest situation, and right from the door, I know the first thing to do, because I've been in that situation so many times. And you probably have a similar experience as well working in ED.
Yes.
Do you get? So use those strengths to your advantage. There was one thing I began to tell myself mentally in my head when I used to have those imposter syndrome during the first year. I would say, it doesn't matter how good these people are around me. If we all had to put a patient on renal replacement therapy or hemofiltration of a patient, when it comes to that topic, I am number one. Because let's face it now, whether we like it or not,
Yeah,
ACPs
with your
are
experience in
competitive. They
ICU
are
and your postgraduate
competitive.
training. Yeah, with your postgraduate training. Yeah.
Do you get? So it's just things like that. Like for you, Biodun, yours could be something like, well, I'm an ALS instructor.
Yeah.
What do you get? It gives you that advantage that other trainees would not have that. So use that strength to your advantage. Be willing to share that knowledge with people, because actually, but when you start sharing that knowledge with people and you're able to help other people through that, it also shows that this person has something to give. This person is competent in this area. There are some colleagues now in my workplace that if I need a hand with interpreting foot x-ray, I already know one person I'm going to for it, because even though he's a trainee, that is his area of expertise. Do you get? So I think sometimes you have to be willing to give yourself grace. You recognize that you've also got strength, but also have the self-awareness to say, right, I need to focus on this, and this area. And of course, networking as well, because if you have imposter syndrome, other trainees will also have the same thing. So it's always good to kind of, share ideas, share opinions, and be dedicated to self-development.
Absolutely. Thank you for that. We have run out of time, but I just want you to answer this question. So someone said, I saw online that Masters ACP is 3 years full time. Do you do this program as full time or part time essentially?
Okay, so the ACP, the Masters in Advanced Practice, is a 3 years part-time masters. You can either do that as an apprenticeship or non-apprenticeship route. But the whole idea is that you're working clinically and also studying. So, for instance, a full-time job is 37.5 hours. When you're studying for your master's in advanced practice, you might be working, let's say, maybe 30 hours at work, and the remaining 7.5 hours will be spent at uni studying the modules that you need for your master's. So the whole idea is that you're training in a trainee role, you are working clinically while also studying part-time to be able to achieve this full master's.
Yes, absolutely. And someone just comment and say the session has been informative and mentorship and God is one of the key factors. So we're going to end the session here, but I just want you to give us your final thoughts before we end.
Final thoughts. Never be afraid to try, because honestly, the world is full of so many people who said, let me just give it a try. I might not be fully qualified, I might not have everything, but let me just give it a try. And if you because honestly, there are people that want the trainee ACP post and are not taking action, regardless of how qualified you are. If you don't take the first step, you're not going to get a job, essentially. Another thing I'll say as well is it doesn't matter how many times you have to apply, because I know people that are fantastic at this in what they do. They've got the experience, the skills, they've got that essential criteria to apply, and they have applied multiple times and they're not getting it. Apply again. If you're listening to this, apply again. Go for that job again and again, because it doesn't matter how many times you have to try to get that dream job. And another thing as well is that the next time you go for that interview, technically you have an advantage because you've been there before. You've gotten feedback from your last interview, and those are feedback that you can then use to improve yourself. And I also know that not everyone wants to be a trainee ACP, and that's absolutely okay. That's fine. There are people that want to do, I don't know, other leadership roles or other senior roles within nursing. That's absolutely fine. But regardless of where you see yourself, number one, find what that dream job looks like for you. Find mentors. Find people that will show you, the path to get to that dream job. And also give yourself time. But one key secret I find in anywhere you are in nursing, if you are someone that wants to progress, self-development is key. Is gold in nursing. Self-development is gold because that's what puts you ahead of your competitors. That's what opens opportunities for you. Take on opportunities that give you the advantage and opportunities that give you the opportunity to be in a leadership role. Sometimes those could mean taking on responsibilities at work that you don't get any extra pay for. Because I know a lot of our colleagues don't give us they don't want any extra responsibility. Because why would you want more work for no extra pay? But actually, you're in training, you're preparing yourself. That's why you're preparing yourself for
Have
that.
a goal in mind.
Yeah, you have a goal in mind. And that goal in mind is what keeps you active, is what keeps you motivated. So these are all the ways that you can stand out. But at the end of it all, never give up. If it's something that you want, never give up. And that applies to whether it's a trainee ACP post or a different band 6, band 7, or band 8 role, I think a lot of the ideas and concepts that we spoke about today we apply to multiple leadership roles. And as self-development, never give up on your dreams. Look for mentors that will support you. Seek out resources, courses, and things that you can do to be able to, get to that next step.
Absolutely. So I'll just add to that to say that it's been a rewarding career for me. And if you're thinking about being a trainee ACP, I would highly recommend that you go for it. It's been rewarding. I've been enjoying the training, although it has its challenges, but I'll say it again that it's been a rewarding experience. So finally, somebody asked that, do you have to change to NHS before you can get on the training?
You see, when we talk about NHS, there are also community ACP roles that don't fall under the NHS. You don't necessarily have to change to the NHS to get on the training, but you have to be able to demonstrate the basic criteria that they want. So if you're working in private hospitals, for instance, as long as you have
in a care home.
So that's the thing. So if you're working in a care home, it's a bit different now. The most important thing is that you meet the basic criteria that they want for the job application. And also it depends on the job that you're applying for. So working in the NHS, I haven't seen any advert that says you have to specifically be working in the NHS.
Before you can apply for the job.
No, you don't specifically have to be working in the NHS, but ideally you need to have experience that is relevant to the job. So if you know that the job is in the NHS, let's say in ED, for instance, ideally it would be nice if you have experience in ED because that will help you get the job. If you are working in a nursing home, ideally I would consider switching to a job that gives you more exposure. That might be in a private hospitals, because I know some private hospitals actually have ITV departments. Some private hospitals have, different specialties. The main thing is that you have the experience, the knowledge, and the basic criteria that they need to be able to apply for the ACP roles. Now, also bear in mind that there will also be other candidates who are already in the NHS, possibly already working in that same trust, that are applying for that job with you. So those are going to be your competitors. In fact, in some cases, you might actually have people who are already trainee ACPs. You might actually have people who are already trainee ACPs in a different NHS trust also
applying for the post of a trainee ACP in your specialty. Yeah.
You see, so you have to be able to think about how to give yourself the advantage.
Yeah, but I think this person is asking that if they want to be a trainee ACP, do they have to come to the NHS? And I'll say yes. Most trainee ACP roles is in the NHS. Or are there private trainee ACP roles? I'm not aware of any.
So I know that most of them are in the NHS. You're absolutely right. Mm-hmm. But then there are also jobs that don't fall under. They word it differently. I'm talking about things like community trainee ACP post. So
that's still NHS.
Yeah, some of them might have advertised as health service, something health service, as opposed to NHS Foundation Trust. But
we're still under NHS. We're all still under NHS. So this person asks, do you have to be band 6 before you apply for the ACP role? I think we've answered that question earlier on.
I'll let you answer that one, Biodun.
I mean, for me, left to me, I'll say be a band 6. It helps you in the job application. It helps you when you're doing your interview. It helps you even prepare for the role itself, because it's a leadership role. It requires a lot of clinical decision making and the rest. But it is not a criteria, an essential criteria. As a band 5, you can apply for it. But I'll say, as an IEN nurse, please just be a band 6 first before you apply for the role. It just saves you a lot. It saves you that much disappointment. It saves you the stress of applying and them not even picking you for the interview, Because even those that are band 6, they will apply and they will not pick them.
Yeah, that's true. So to put it into context, I applied as a band 5.
Okay.
But then again, I applied as a band 5 in ITU with a postgraduate critical care course. So I was talking earlier
So
on
a
about,
band 6 trainee ACP role,
yeah,
not
but
to a
we
band
all
7.
started. So what happened is they advertised the job as a band 6 or 7 trainee ACP role. Now, what differentiates the band 6 from the band 7 is that they've completed some kind of modules that are relevant to advanced clinical practice, as in they've basically started the journey, right? So I applied as a band 5, but thinking now from when we did the recruitment for my trust, when I actually interviewed candidates for my trust, what we look at is essential criteria, number one. Then, if you have desirable criteria, it gives you an advantage. You score more points, basically. So, if you're a band 6, you're going to score more points because that's clear evidence of clinical leadership. If you have done postgraduate modules, you score more points because that's already evidence of that can follow that evidence of either education or research. So there are certain things that give you more points. You can apply as a band 5 if you're applying for a band 6 trainee ACP post, but nobody is going to really give you that opportunity. Well, I won't say nobody, but it's hard to find the opportunity for you to jump from a band 5 to a band 7. For me,
I've
I
heard
went
of somebody that did that, but again,
really.
yeah. But again,
Oh,
yeah,
that's
I know this
interesting.
person. Yeah. But again, for everybody listening to us, it's left to you. You know your skills the best. You know how you fit into the desirable and the essential area of your application. But my recommendation is be a band 6 for a trainee ACP band 7 role. But if it's a band 6 trainee ACP role, if you're a band 5, you can apply. That would be my recommendation. But
But
no,
also bear in mind that the people that you're competing against will be band 6. So it's about looking for the best ways to basically put your best foot forward.
absolutely. Thank you, Linda, so much. It's been an informative session. I myself, being a trainee ACP, I've learned some few things from you from this session, and I hope those that are going to watch the replay or those that are part of this session are going to leave this session be more informed about what trainee ACP is all about, and hopefully take that leap of faith. So, thank you very much, and that'll be the end of today's session.
Thank you so much, Biodun. Thanks for having me.
All right, take care. Bye bye.
All right. Take care.
Bye.
Bye. Bye.